So we realised that there was a gap in our service for pressure care. When we were working on the medical ward, we thought that equipment and policy and also education would be a key thing to helping us work in a more holistic way to help improve that on the coast.
And so involved in the project has been myself, Kimberly the dietitian, Tara Jobson, occupational therapist, Megan Thorby, physiotherapist, and we were supported during the policy development and the initial stages of the education by nurses Viv, Bernie and Annie from the wards.
The term pressure injury is what we use now instead of the old-fashioned bed sore. So you get a pressure injury from having pressure on a part of your body or skin for too long. What happens is the skin then breaks down. It starts off as a red area, it can get pussy and it can go all the way down to the bone. They're really painful and horrible, so we're wanting to look at complete prevention as a way of stopping this. We had limited high-level resources and equipment to help with pressure care, such as mattresses and overlays. We also needed a clearer policy and procedure about actually this is what we're supposed to do and this is best practice. And I think that there was a need to update the education and knowledge of all of our staff, both allied health and nursing, to make sure that we work together more succinctly to make sure that patients get what they needed at the right time.
The role of the dietitian in pressure injury may not seem obvious to most people. So malnourished patients are at a high risk of developing pressure injuries, and they will also impact their healing if they already have one developed. The role of nutrition in wound healing. Protein is what your skin's made of, so if you're not getting enough protein in, then you're not going to be able to regenerate those building blocks for skin again, as well as getting enough vitamins and minerals to support the healing process.
Looking forward, well, previously we've already organised and we've got a new policy in place. We've got new equipment and mattresses coming into the hospital regularly. Looking forward, we're looking at education for all staff, so that's allied health and nursing. Coming up, we have Train the Trainers Day, so creating a bit of a champion program for pressure care. So that will be mainly nursing staff getting educated around the role of allied health and how we can assist them with pressure care. So that's looking at both inpatient nurses, rural nurses, working with rest homes and all the other players involved to make sure that all patients across the West Coast get the same support for pressure care needs.
Now we're working with Sonia, the clinical nurse educator, in the final stage of rolling out our education sessions. This project is part of the DHB's ongoing commitment to quality improvement.